Good morning, everyone. Today we're talking about the Delta variant of the COVID virus. So there have been some questions prepared for me to help me talk about it, and I'm going to go through this. And if there's other questions, I'm happy to answer them the best I can. Okay? So some people would ask, what is a variant? Well, viruses tend to mutate. So that's why every year you have to get a new flu shot, because the flu virus mutates and it's a little different over time. And there have been several major mutations of the COVID virus. So the Delta, the one we're talking about today, the Delta variant, is a new mutation that seems to be very significant. You can guess from the Delta that this is the fourth major variant. There was an Alpha, a Beta. What would be I don't even know what the third one is. The next one's an Epsilon, but the Delta is the one we're talking about now. It was first detected in India and created quite a large blossoming, as it were, of the COVID virus, with a lot of people being sick and hospitalized. The reason so the question, why is this different from other variants? It seems to be twice about as transmissible as the Alpha variant, which was more transmissible than the original COVID virus. So as we get these new variants, at least in this case, it's more easily transmitted. And there's numbers like 60% in some studies more transmittable or more easily to be passed from person to person than the Alpha variant, which was more easily passed than the original COVID virus. So this is the reason we're concerned about the Delta variant, is it seems to be significantly more transmissible, passed from person to person. At the same time, it seems to be affecting more younger people. So in England, where this is the major strain right now, the rates below the age of 50 and above the age of 50 are about the same. And when COVID first came, there seemed to be not as much difficulty for younger people, but with this Delta variant, it seems to be as much a risk factor for younger folk as for older folk. Another concern is that it's potentially, and we may not know for sure, but it seems to be more serious in terms of the disease it causes, as much as perhaps twice. So where we're able to study this the most is in England. And if you have the Alpha variant or one of the earlier COVID type infections, if your chance of being hospitalized is here, if you have the Delta, it's twice as much. So the folk that have the Delta variant are twice as likely to be hospitalized. So based on that data, they feel like the Delta variant is not only easier to be passed, but it is also makes you sicker. And your chance of being hospitalized is higher if you have this variant. So that's why the Delta matters. That's why we're concerned about it. It clearly created quite a crisis in India recently. Why does this matter to us? Isn't this just in India? Well, it turns out this virus knows how to spread, and it's already here in the United States. They're saying now that it's doubling every 2 weeks. The percent of COVID infections now in the United States is somewhere between 20%, as high as 20% that is Delta. It might be as high as 40%. So it's here, and it's starting to ramp up. let's see, I've got some other questions also, like, does the vaccine work against the Delta? Good news. The vaccine's pretty effective now. Not quite as. So the most recent study I saw, 88% with Pfizer after 2 doses. Not after one, it's not as good, but after 2 doses, 88% preventing a hospitalization, but perhaps 60% preventing infection. So even if you've been vaccinated, you could still get COVID, the Delta variant, but your chance of being hospitalized is much less. So right now, especially with social distancing starting to stop and masking starting to stop, our best defense is to get vaccinated. It's very important to get vaccinated because of this Delta variant. What else can we say about this? Oh, another thing about the Delta variant. The symptoms might be a little different. There seems to be more headache, more sore throat, more runny nose, not so much cough and loss of smell. You probably remember with the Alpha variant or some of the earlier COVID infections, the cough was the main thing and the loss of smell early on. But now they're finding that with this Delta variant, there seems to be more of these other things that are more like a common cold. Sore throat, headache, runny nose, and fever. Usually with a cold, you don't get a fever. So if you get a fever, we probably should get tested for COVID along with some of these symptoms. So the symptoms are a little different. Another thing that's a little worrisome about Delta variant is that you've probably heard of monoclonal antibodies. Some of the treatments that they use in the hospital for the sicker patients are less effective against the Delta variant. So there's a combination of reasons why we're concerned about this new Delta variant. And right now our best option is to get vaccinated. So if you haven't yet, it's not too late. They're looking at a possible new wave from the Delta variant. It could be in a few weeks or it could be in the fall. We hope it doesn't happen. We hope there's enough people vaccinated that it really prevents this variant from taking off. But if you haven't been vaccinated, please get vaccinated. Okay, any questions?
Can people still get vaccinated here at PTHA?
Absolutely, you can still get vaccinated at the health authority. You can still drive up. The drive up isn't down in the parking lot of the old casino. The drive up is right in our parking lot at the health authority. You just drive up there and you say, I'd like to get vaccinated, and they run your data, and they hopefully you can get your shot.
Is the vaccine is it prevalent here in our area yet? Do we know that?
The Delta?
Yeah.
Yeah, in Washington State, I think it's at 20%. A couple weeks ago, they think the 20%, but it's doubling every 2 weeks, so it could be as high as 40% now of the COVID cases are Delta. So it's here and it's starting to increase. Yesterday I saw a patient with COVID, and I'm pretty sure it was a Delta variant. And the reason is, like I said, the symptoms were a little different. Seemed like headache and sore throat were the main thing, as opposed to in the past it was more cough. Any other questions?
I don't think so. I think we're good.
Thank you all, and boy, if you have any influence on anyone, please encourage them to get vaccinated. Even the folk now clear down to 12-year-old, it's important, because this Delta variant, before COVID, didn't seem to bother the young people as much, but this one does. So it's getting more and more important to vaccinate, and hopefully soon we'll be able to vaccinate even younger than 12, but we aren't able to yet. So have a good day.